It's a very great honor to be here and present on the therapeutic potential of adult hematopoietic stem cells within the focus in athletics, immune enhancement, and anti-aging effects. So I want to explain how the stem cell works and in real clinic settings, how we can use it with many cases. Aging population, rising patient demand, media-driven perception shift, and therapeutic potential for various diseases. All of these are the reason why we have to focus on stem cell therapy. The regenerative medicine market is expanding rapidly. During the Border Intelligence reports, the global stem cell market reached to $30 billion in 2019 and is projected exceed to 16 to 19 billion US dollars by 2025 and is forecasted to exceed over 30 billion US dollars by 2030. So it's increasing very fast. And look at the fields, how they use the stem cell therapy. First, orthopedics is the most biggest market and it shares about 23% for the treatment for pain reduction, spinal fusion, and age-related joint degeneration. And the second, neurological disorders such as Parkinson's or Alzheimer's disease or stroke. The neurologic disorders are increasing very fast with the CAGR 11%, and it is for the improving motor function, and it can be the expansion is enabled by the BBB penetration and invasive cell technologies. And other fields includes cardiovascular disease, hematologic cancers, and diabetes. Then, let's look at the definitions of stem cell. What are multipotent stem cells? Multipotent stem cells are undifferentiated cells derived from embryonic or adult tissues. And it has capacity for self-renewal and the capacity to differentiate into multiple but limited specialized cell types. So these are not pluripotent stem cells. And the categories of stem cells includes hematopoietic and mesenchymal stem cells. First, hematopoietic stem cells are responsible for generating all blood cell types, including immune cells, platelets, and red blood cells. So they are mostly in red bone marrow, and in some cases, small numbers found in peripheral blood, especially under stress or proper stimulation. And as Richard mentioned earlier, CD34 plus is the surface marker for human hematopoietic stem cell and progenitor cells. So by using flow cytometry, we can identify the quantitative and phenotype analysis. So the CD34 plus marker-based isolation is very important for stem cell transplantation, cell therapy, and hematologic research. This shows the total count of nucleotide cells and CD34 plus cells. So from the blood and after the concentration with using smart M-cell system, the total numbers increased about 4 to 15, so about 3-fold. and 1.84 to 11.22, so about 8 folds. And look at the cytokinases. There are also a lot of growth factor and cytokines in this system. So the PDGF and EGF and VEGF are very important growth factors, and these are associated with tissue regeneration. And the second, interferon gamma and P-selectin cytokines are associated with immunomodulation. And the last, MMP1, is an active matrix turnover and tissue modeling. The total concentration of these growth factors and cytokines also increase about 3 or more than 10 times after using the Smart M cell system. And let's look at the mesenchymal stem cell. It is in bone marrow and adipose tissue, so it has the capacity of differentiating into osteoblasts, chondrocytes, myocytes, and adipocytes. So they are regulated by various bone marrow resident cell types, including fibroblasts, endothelial cells, and other immune cells. So we can extract the mesenchymal stem cell from the bone marrow and also the fat. And the concentration, the count of total nuclear cells and CD34 plus cells also similarly increases after the bone marrow Smart M cell system. It is very important to know about the working mechanism of adult stem cells. Adult stem cells are a group of undifferentiated cells that can differentiate and self-renew existing in adult tissues. But they exist and maintains a quiescent state. They don't act until an appropriate signal is activated from an external stimulus. So when it receives stimulation and damage, it escapes from the microenvironment and proliferates. So it differentiates and replaces it with special cells suitable for it. So adult stem cells performs the roles of maintenance, regeneration, and repair, and maintain homeostasis. At Therapeutic Clinic, we use the stem cell therapy just like these things. First, orthopedic applications, we use the bone marrow extract to make the cartilage regeneration and to reduce inflammatory pain. And about neurologic applications mentioned as before, Parkinson's disease, stroke, or dementia, we use the peripheral blood stem cell IV infusion or direct inject to the common carotid artery. And the metabolic and vascular support, such as diabetic ulcers or vascular insufficiency, we can make the angiogenesis and wound healing. And the last one, anti-aging and aesthetic medicine. We use systematic IV infusion of peripheral blood stem cells or bone marrow stem cells, and local direct injection to the wanted area, skin or scalp or penis or something like that. And we are focusing on the immune modulation and hormone balance with the anti-aging effects with the lab test. So first, let's talk about the NK cell activity. It's about the immune system. NK cells are lymphocytes that play a central role in early immune defense. It can rapidly respond to virus-infected and malignant cells without prior sensitization. So, low NK cell activity level is linked to cancer or viral infection, maybe chronic, or autoimmune and inflammatory disease, and immunosenescence in aging. And this is one case, 66-year-old male, 240 ml of peripheral blood stem cell IV infusion once. The level of NK cell was 400, about 400, and increases to 1,190. And another case, 81-year-old female, 204 ml of peripheral blood stem cells, IV infusion twice. So the level of NK cell activity has increased from 215 to 638. And this study has more participants with 44 female patients, mean age 46 years old were included, and they were done the treatment because of the anti-aging or chronic fatigue or dermatologic issue or menopausal symptom, and some of them had cancer history like the breast cancer and stomach cancer. So let's look at the changes in NK cell activity. The mean level of 44 people were from 504 and has increased to 783. And according to baseline levels, group A means the before level was under 100, and it means very abnormal NK cell levels, and they may have some cancer issue or immune problem. The first before the levels were about 50, and has increased to over 600. And group B, the first level was between 100 and 249. The mean level of the first before level was 149 and has increased to 379. And group C, the first level of the NK cell before the treatment were over 250. The level has increased from 352 to 1,100. So in every cases, the NK cell levels increased, and there are another biomarkers for anti-aging. We can get the blood test and check the IGF-1 level and DHAS level. So IGF-1 means the peptide hormone produced in the liver, and it is stimulated by growth hormone and has a very important role in cellular growth, differentiation, and repair. So low IGF-1 levels means loss of muscle mass and loss of cognitive decline and delayed tissue regeneration. So IGF levels has to be normal or maintaining optimal to improve physical performance and enhancing metabolic function and for the potential longevity benefits. Here is one case. A 63-year-old female, 240 ml blood stem cell therapy, IV infusion once. The level has increased from 87 to 106. The reference range for her age is from 57 to 191. The IGF level is growing more slower than the NK cells, but it is very important for the anti-aging. And the second case, 53-year-old male, 240 ml of peripheral blood stem cell IV infusion twice. The level increased from 91 to 145, and the reference range for his age is from 70 to 115. And what is DHEAS? Is a steroid hormone made by the adrenal cortex, and it can be a precursor to androgens and estrogens. So high DHEA levels mean immune function and anti-inflammatory response is working well and can improve mood and stress resilience and supports the bone density and skin integrity and libido. So this all means DHEAS is a biomarker for anti-aging and metabolic benefits. So there is one case, 63-year-old female, 240 ml of peripheral blood stem cells, IV infusion once. The DHEAS level increased from 106 to 178. And another case, 64-year-old male, 240 ml peripheral blood stem cell, IV infusion twice. The level increased 210 to 255. As on his age, the level 200 over 200 is a very high level, and the higher level goes more higher. And let's talk about local injection. Anti-aging effects for skin rejuvenation. As we get older, the skin layer thins, loses elasticity, and wrinkles form. So when we use the blood stem cell or bone marrow stem cell, directly inject to the wanted area of the skin, face. It makes collagen regeneration, elasticity, and wrinkle improvement. Then, the target skin layers. The epidermis has no blood vessels, so we don't recommend these areas, these layers. The dermis layer has very many fibroblasts and collagen and elastin, so in this area injection, we can promote the enhancing of wrinkle reduction, skin texture, and elasticity. So here are the picture of needle and cannula to the dermis layer injection. And the subcutaneous layer is effective for deep wrinkles and volume loss, especially for nasolabial folds and cheeks. So for overall rejuvenation, we recommend dermis and subcutaneous combined approach. And in case of alopecia, blood stem cells or bone marrow stem cells, injecting directly into the hair loss area. It can promote hair follicle cell proliferation and hair growth, resulting in increased hair count and improved thickness. And how about the scalp injection layer? Hair follicle bulge zone, we have to target this. So the recommended depth is 1.5 to 4 millimeters, and it is different according to the area. The frontal scalp and thinning area, we recommend 1.5 to 2.5 mm, and the vertex and crown area, we recommend 3 to 4 mm. And multiple injections are good, so each point you have to use 0.1 or 0.2, 0.3 ml each side. And nowadays, not just the face or scalp, but also the male function or female function, many people want this improving. So direct injection to the penis or vagina can make increases erectile strength, stiffness, and persistence. Here is a clinical trial named INSTINCT Clinical Trial. It is about autologous bone marrow mononuclear cell therapy for post-prostatectomy erectile dysfunction. And in this clinical trial, they use bone marrow stem cell, 50 to 100 ml. And let's check the injection procedure. First, anesthesia, local penile-based infiltration anesthesia with optional mild sedation. And injection site was bilateral corpora cavernosa. I will show you in the picture after this page. Proximal shaft. And the approach, lateral approach is recommended, 3 o'clock or 9 o'clock positions, and using 23 or 25 gauge needle. And the depth is 5 to 10 mm into the cavernous cell tissue. And the total volume, they use just only 1 ml each, 0.5 per side or 1 ml for a single side. But actually, when we do in our clinic, we use 10 or 15 or maybe 20. And they use color Doppler ultrasound to verify correct placement. And they target it near the cavernous artery, not intra-artery, to promote vascular niche regeneration. And the rationale shows this procedure can make angiogenesis, endothelial restoration, and smooth muscle regeneration, and they can help the function of male gets better. So this is a Doppler sonal picture. The left side is a normal, and the mean peak velocity is very high with the normal person, and the right side is not abnormal, who has male dysfunction. So the artery supply is not good, and the mean peak below is lower than the left side one. And this is a coronal view of the corpora cavernosa. So we have to target to the two side of the corpora cavernosa. So this is a picture. We recommend for the male function, injection site, bilateral, and proximal penile shaft. And approach is 3 o'clock or 3 o'clock and 9 o'clock, but 2 o'clock and 10 o'clock is also okay. And using 23 or 25 gauge, and the depth is 5 or 10 mm according to the volume of each person. And before I mentioned, the volume needs to be more, so the result, the patient result may be better, I think. So we recommend 10, each side 5, or we can put more stem cells up to 20 ml, and so we need to 1, 2, 3, 4 injections in the anterior side and the posterior side. And the next one is for the female sexual function. It can be used for vaginal atrophy, urinary incontinence, and sexual dysfunction. And look at this clinical trial. This have 2 clinical trials about, one is PRP administration to the lower anterior vaginal wall, and another one is using adipose-derived stem cell. So the injection procedure is the anesthesia, topical cream, and injection map, just like this picture. Here, clitoral region at 12, 3, and 6, and 9 o'clock, 1 ml each. And here, paraurethral anterior vaginal wall, right and left, 1 ml each. And mid-urethral, center, right, left, 1 ml each. And using 21 gauge, if when the patient feels so much pain, they use the 31 gauge needle. So the total volume is 9 ml and used within 5 minutes. So the mean female sexual function index shows going up, and these 6 pictures all show the satisfaction of the patients. So I have presented about the IV infusion therapy of peripheral blood stem cells and bone marrow stem cells, and the local direct inject to each area they wanted. So the IV infusion and the local injection, both of them are very effective, and the patient's satisfaction is very good. So I really recommend. And at Therapeutic Clinic, we are dedicated to providing more evidence-based, personalized stem cell therapies that combine medical innovation with athletic science. Thank you for your kind attention.
Thank you so much, Dr. Kim, for that very informative and inspiring presentation. Your insights have truly deepened our appreciation for how these technologies are changing lives. At this point,